So now we're going to be moving on to a update from the Child and Adolescent Health Service. So I'd like to welcome Melanie Robson, who is the Director of Aboriginal Health for CARS, and Terri-Lee Barrett, who is Head of Nursing within, and Isabel Redfern, also from Cash Nursing, although you didn't quite get your name on the gig, to update us on progress we're making in Child and Adolescent Health Service. So press the green button.
Okay. Thank you. Thanks, Peter. I don't know how to follow that. That was pretty impressive. But anyway, the three amigos are here to do a presentation. Isabel thought she was getting out of it, but no, that's not going to happen. Frida did a beautiful welcome this morning, so I'm not going to read through our acknowledgement. We've done a lot of work writing an acknowledgement to country from us as a health service, recognising that our footprint goes down to Binjarab country as well as Wadjuk country, but also we service Aboriginal people from across the state, and we're committed to making sure that our First Australians take their rightful place, because we're committed to equity and diversity, but we also want to recognise that our First Australians, like you all know, are the most disadvantaged people probably in the world. But CARS always puts up their values and our priorities, and these are really important to us, and we always have to reflect these in our work and everything we do. A lot of this work is around collaboration, definitely respect and accountability, like I was talking about this morning, but it crosses into equity and compassion as well. So there is the three of us. You know who we are, and I'm sure the others will introduce themselves. I'm just going to do a bit of an introduction. I've got some words to read, but I'll try and make it interesting. So just a little background. We did present in 2023, so we wanted to come back and give you an update of the progress we've made in our child and adolescent community health, because we actually have done quite a bit in the last 12 months, and I actually can't believe it's been 12 months, but anyway. Following the outcome of the WA Auditor General's report regarding Aboriginal children and their ear health in WA, some of the recommendations that were handed down to the Department of Health, to WA Country Health and ourselves, there's three recommendations we've been really focused on, and this is probably very similar for WACS as well. So working actively with stakeholders to progress the WA Child Ear Health Strategy. We've been really heavily involved in that work, and a couple of us are on the advisory group, and we're really committed to the work that Peter's leading and we're doing. The design and implementation of co-design services. So we've been working really hard, and Isabel and Terry are going to go into some of the details around how we've been doing that as well. And then leveraging already strong and trustful contacts with Aboriginal families. So we know that increasing early detection of otitis media through ear checks, which includes, those physical ear checks with the Aboriginal children that we see as well. So importantly, the report also recognised that there are many organisations working in the ear health space, providing wonderful services, but there's little coordination and there's a lot of overlap in those services, and you guys know all this as well, particularly when it comes to Aboriginal children. We've got to get smarter, be more strategic, and we're really driven to do that, but we can obviously only just control our patch. And over the past 12 months, Catch has really worked hard to develop and implement a new collaborative model of care, including a screening process around our school ear health screening as well. So I'm going to throw to Amigo 2, Isabel, to do the next two slides.
Yes, I did think I was going to get out of this, but, Mel, that one?
Green one, that one there.
Beautiful. This one? You might need to operate it for me. Clearly I'm not that clever. Okay, so Community Health identified from the Office of Auditor General's report the fact that we needed to revise our, I'm not using my notes, which is pretty bad, but that's all right, I'm going to talk anyway, that we needed to do earlier screening for children, and so the recommendations around doing screening 3 times in the first year, and then 6 monthly up until school age, and then annually after that. So working with our colleagues in WACS, we changed our policy, and so now we offer at all universal child health checks a hearing screening, which includes otoscopy and a TIMP. And really pleased to hear the stuff about ear train, because some of our staff did struggle with the TIMPs in the early days, but the story I'm hearing now from our L&D and from the staff on the ground is that the more you do it, the easier it gets, which of course makes sense. But if you only see one Aboriginal child a year, it does become a bit of a challenge. And Terry's going to talk about our wonderful Champions program that we use to help with the program, the training for staff. So as a part of that, we also looked at the policy for the kids in the school age. So our policy for kids entering school is that we offer them a CHA, School Entry Health Assessment. So every kid that comes to school, we will offer them a health assessment, and that's generally kids that are around about 3.5 to 4. And a part of that screening will include a ear health check. So otoscopy, TIMP, and then audiometry if they're old enough to do that, which is really great. So we've got those kids at 3.5, 4, and then we identified that there were some kids in pre-primary and year 1 that may not have gone to kindy, and so we looked at how are we going to get those kids, and so the policy recognised that we should be undertaking assessments on those kids, whether they were Aboriginal kids or kids with a history of ear disease. So that's what we put in our policy. And then we had to do some work around how we were going to make that happen. So I don't even know why I've got notes. So thank you. Whoa, that's not mine, is it? Yes, it is. Yes, it is. So because we have 2 streams, or we have multiple streams in metropolitan area, we have child health nurses who do the screening on the really little kids, and when they go to school, the community health nurses working in schools will do the CHAs. And then we had an amazing Aboriginal ear health team, which is a very small team of, we have 1 north and 1 south that is made up of 1 CN, 1 RN and a couple of ENs. So really small teams, but they covered the entire metropolitan area. And they were doing amazing work in attending lots of schools that had identified 20 or more Aboriginal kids as a part of their cohort, and they would be offering our service to the schools, and they would go in and screen all those kids. They would do referrals, they would do follow-ups. They did amazing work to get those kids seen and referred to the right place. So with the new policy came school health nurses that were also going to be doing it, and we were concerned that we were going to be having potentially school health nurses screening in school A today, and then the ear health team coming in tomorrow and screening, and then the ear bus would come in the following day and screen, and then possibly someone else would come in another day and screen. So we were trying to coordinate it all, which, you know, sounds really easy, but what we found that it wasn't quite so easy. So at the end of 2023, we started having some consultation and communication with both the school health nurses and the Aboriginal ear health team to try and work out how we could work it better. And we had a grand plan to start in term 1 of 2024, and we didn't do it well. So as much as I'd like to say we were amazing and we did it really, really well, we weren't ready to go at the beginning of term 1 for 2024. But that doesn't mean that we stopped screening kids. The ear health team continued to do their work, the school health nurses continued to do their work, and we tried to work together to start a collaborative approach in term 2, 2024. So the collaborative approach was meant to be that the school health nurse and the ear health team would communicate, work together, which days were they going to go to the schools, who was going to send the consent forms home, who was going to get the consent forms back, who was going to record the data in CEDIS, who was going to follow up the students, who was going to follow up with the referrals, and it all just sounds really, really difficult, but the teams have done really, really well in term 2 and the beginning of term 3 to begin to get the collaboration working. And so one of the other things that the Aboriginal ear health team were able to do was use their previous partnerships with the schools, particularly the AI EOs to have those partnerships with the schools, Department of Education and the families to make sure that they were able to follow up those kids that were a bit of a challenge. We identified that we needed to do some upskilling and training, particularly for the school health nurses who tympanometry was a new skill for them and they were a little bit hesitant to do that. So we did some great work with our learning and development, and we started training in late 2023 and finished in early 2024. And this is where I do need my notes. There are currently 169 community health nurses working in schools and 217 working in child health. And all of those staff have been trained and upskilled in TIMS and refresher training in otoscopy. And we all know that we need to do otoscopy before we do a TIMP. And for some of the child health nurses, that was a skill that they hadn't done a lot. And so now I'm going to hand over to Terri to talk about how we did the training and some of the data. Yeah, beautiful. Thanks, Terri.
Thank you. I just wanted to acknowledge a few people in the room actually before I get started. So I wanted to acknowledge Deb, who is part of the Learning and Development team, that were absolutely instrumental in us being able to implement our policy. Brianna, who's one of the leads for our Aboriginal ear health team, and our WACS colleagues who've been doing this for a really long time, but always support us as we catch up. So it sounded simple to me. Let's get a policy, let's get the TIMPs, and I'm sure that you talked about that last year, about the huge challenge that was. And then we had to train everybody. And we also had to do change management. So it's been a journey, and I think we are well on the way. And I think that next year is going to be even better as we take our lessons learned and we're able to start at the end of this year in planning for next year, next school year, so that we actually hit the ground running. Because we've kind of been following the train this year, Brianna, haven't we? But yeah, next year we're going to be driving the train. So what we needed to do to support the staff, not only in their competence but their confidence, was do that alongside the elbow model that somebody was talking about earlier today. So we developed a champion model, and we had two kinds of champions. So we had a super champion and a team champion. And those super champions were predominantly our Aboriginal health team, ear health team, who had been doing this for quite some time. And they were people who had knowledge about ear health conditions, causes and the long-term outcomes of poor ear health, extensive experience with the ear health assessments, knowledge and interpreting assessment results, and also an understanding of Aboriginal culture and Aboriginal family structures. So they were our super champions. And I think that was also part of the thinking behind blending the two teams, was about the fact that we would have these absolute subject matter experts working alongside our school health nurses as they gained that confidence. And the other component to it was about having absolute clarity about who was following up these children, because we've talked a lot today about how screening's one bit, but the following up's a really important thing. So our team champions were our new champions. We have 19 regions within the metropolitan area. That is sort of our governance structure. It's how our team structures work. And so 2 members were identified from each of those teams, and they were selected to provide ongoing support to the teams as it was required. So obviously some people picked it up really quickly and other people took a bit longer to get their confidence and competence. So these champions supported at point of care. They provided education and clinical support. They were advocates for the change, and they were also advocates as to what was going to happen in terms of improving ear health outcomes for Aboriginal children. They were our positive role models as we rolled out the new model. And they also were able to identify with us where there were some areas that might be struggling. So they really demonstrated best practice and applied the policy and procedures as we wanted all the staff to do. So this model helped us to increase our staff's knowledge, it helped them to develop the new skills that they needed, and it helped us to roll out the model and increase our screening assessments. This helped staff to gain their confidence, it supported the change by ensuring that everybody was very, very clear about what we were intending to do, and that it really strengthened that collaboration that we were expecting from all of our teams. So our team champions were trained by our clinical education team. So currently we have 7 super champions, and we also have 30 team champions that are still out there supporting our staff. The big success factors were the significant partnerships that we established, so our ear health team, our school health team, but also we had a partnership with Hearing Australia. And Hearing Australia provided supports, resources and expertise in the form of an audiologist, and collaborated with our learning and development and our clinical education teams. So those 3 partners came together to refine, finalise and provide a training schedule, and the audiologist co-facilitated the training for those services, which was really integral. We had a slow start this year, but I can tell you that so far we have done just under 1,000 children, performed screening on just under 1,000 Aboriginal children. Our data tells us that we've got a cohort of just over 3,000 between our kindy, pre-primary and year 1s. And then we've also got targeted children who've got a history that we're following up into those latter years of primary school. So we're starting to really see that we're making progress. We've been keeping a close eye on the data. We had a few little heart attacks about the data to start with, because it looked really terrible, but then we found out there was a problem with the back end of the system. So we were able to see what was actually happening and take a big breath. The need for communication and collaboration also with the schools has been critical, and as Isabel said, our Aboriginal ear health team already had those really strong relationships with particularly the AEIOs, and our school health nurses also have really strong relationships with the schools that sit within their catchment area. So all of those working together has enabled us to start to really see some achievements. The other thing, of course, is the strong connections with the families and communities to make sure that what we're communicating to them is really clear and they can understand what's happening to their children, that we can build trust and an understanding about the service, about what a phone call means, what it means for their child, and what the next steps for their child are to make sure that there is that follow-up and follow-through. So the impact I want to demonstrate just through one example. There was some children and all of those partnerships and bringing into the partnership ENT services, performed surgeries close to home through those supports, and one of the children was quoted as saying, "Mum, I can hear you and you, Mob, are talking too loud." And I think, that demonstrates really what we're all here to achieve. So back to Mel for summaries.
Thank you. And look, I had nothing to do with any of this. I just bossed these people around. And I want to acknowledge Sue Kiley, who's our Executive Director, who's sadly departing us, and we're all heartbroken. But, her leadership and innovation in this space has helped us to be able to achieve this success. But also want to acknowledge Isabel and Terry as well, because they've really driven this stuff at the clinical level, and all the people in our team. Like, there's so many people behind us who work within Catch and are really committed and really passionate about making things better for our Aboriginal children when it comes to hearing and ear health. And we've discovered that our refugee kids are actually probably worse than our children, which is scary to say. So there's a big piece of work there as well. But, you can drive change, and how much Catch has achieved in the last 12 months is actually really phenomenal. And I really want to applaud the team and all the people who aren't here today, Bree, Deb, and there's so many other people as well, because they've done a phenomenal job. I just want to acknowledge, because we've got a little bit of time, The artwork in the back is Tyrone Wangana's artwork, and it's about the journey into our service. And, you know, we've worked really hard to embed that into everything. So Catch's colour, base colour is purple, goes with the purple book. You know, Cam's has a different, so we all have different colours in our service, but Tyrone's art is just critical to that. And the journey could be from regional or remote into PCH or neonates, or it's across the metro into our Catch and our Cam services. But, you know, at the end of the day, it's such an important journey, and underpinning all of that is cultural safety. And, you know, the team has really taken on the vision I have for CARS when it comes to Aboriginal health and really made a difference. So, you know, huge kudos to them. We probably have a little bit of time for questions. If anyone wants to ask questions, and I won't be answering anything, I'll chuck the ball to these guys. But, you know, just, and also to thank WAX, because they have been phenomenal in sharing and guiding and supporting us, you know, to Corinne and the team over there. And we always work really closely together. And, you know, these sort of forums remind us of all the other partners that are out there as well with us. So, questions? Oh, yeah, and thank the team. No.
Any questions for the CARS team? I'll just start. So, if you include all the child health nurses, as well, how many staff have been trained over the last couple of years?
Well, I can give you FTE, numbers, so it must be 400.
Yeah.
So 169 community health nurses and 217
Yeah.
child health
Okay.
nurses.
So 400. That's a lot of people who are now ear health workers, I guess, aren't they? So that's great. So I think that's important. And in terms of maintaining competency and onboarding new staff.
Yep. So everyone gets to attend. Sorry, Terry. So everyone gets to attend the orientation when they join CARS. We have the L&D have a week of orientation. I say a week, but it's probably 3 days of orientation, and everyone gets to learn what they need to do during that first week. And then they actually go out and practice it in the community under the supervision of a mentor. And when they feel as though they're confident, someone from the clinical education team will come and deem them competent. For those staff that, as I said, you know, might only see one Aboriginal kid or one refugee health kid a year, we encourage them to go somewhere else or get someone to come with them if they're feeling as though they're not confident rather than competent. And I think confidence is one of the really important bits for staff. As I said, the more they do it, the more they feel confident.
And the champions are still out there to support them in that circumstance as well.
Phone a friend. Not me, but phone a friend. Yep.
Any other questions?
Mel will come back next year and tell you how well we've done this year.
Yeah, that's right, and we'll have a bit of the outcome data as well. I think that would be great.